you all are experts in this particular field. You work closely, you prescribe yourselves, you work closely with endocrinologists and cardiologists, primary care. If I'm a community pharmacist out there, what's the most important things and aspects of GLP-1 agonists that I need to know from a product distribution, from a counseling, from a progression perspective that I need to know if I'm out on that front line in the community?
First thing I think they need to know is the prescription written correctly? Are the pen needles, if needed, coming with it? The other is storage. And we see this often with not only GLP-1s, but I see it with insulin, where patients get confused of where do I store it. At a patient,
and it's not the glove compartment on a 100-degree day?
Oh, of course it is.
Well, that's why yours ran out too soon.
If you can't leave your son or daughter in the car, don't leave your GLP-1s,
right,
your insulins,
exactly.
and your other protein
Yes.
therapies? Okay.
Yeah, but it's a big thing. I see so many times that patients will put the used product, what they're using, in the refrigerator, and the unused for later is stored above the refrigerator or in a
like
cabinet.
we think of perishable items as food.
Exactly, exactly. So again, storage is very important, that these do need to be refrigerated and kept in the refrigerator until use. So, it's something as simple as that. And then also, the pharmacist needs to make sure the patient knows how to use this device correctly. Don't make the presumption that the doctor, the diabetes educator, the nurse, or even the pharmacist at the clinic did the education. It's better to hear
Or that they don't need it more than once.
Exactly.
Right.
It's better to hear it 2, 3, 4 times than none. So I think, again, show me how what were you told and how to use this? Using those open-ended questions, making sure that the patient has everything they need to go home and use the medication correctly.
And Troy, the other thing that I would say, we talked about how many are in the class, and there's 6 or 7 of them, and they all have a different device. And I could tell you that we all probably have a formulary that we figured out, and you're like, this is the only one I can get covered in my area. So we get comfortable with maybe 1 or 2 devices or 1 or 2 agents. And you can't expect, everyone to keep up with 6 or 7 of them. But now, because of technology and what we have, it's easy to pull up a YouTube video. So in some of my cases, I'll say, let's watch a video. Maybe it's not this demonstration, or you can just write down the link. They can go home and watch it again if they forget it. And so there's different ways you can, if you don't know the newest and latest device, now you have a lot of manufacturer videos and resources that you can pull from to kind of augment that, where if you know how to general gist of the counseling points and the general gist of the instructions, then you can kind of just figure out those differences. So I hear that a lot from pharmacists, where like there's way too many devices, and it's kind of like what happened with the glucometers. It's like, just learn how to use one and then just point out the different bells and whistles. Similar things could be adapted and used here.
And you bring up a great point. Most of the companies have good support system and great patient education tools. I don't know any company that is not willing to support patient education, because again, it goes right back to, if the patient doesn't use it or use it correctly, the drug is worthless. So even directing them to the patient page on the website, or giving them a handout on what to do, again, providing that education to the patient.
Well, and I even think, I get the question enough just in my clinic, and I know I went over this with the patient, is the missed dosages. And so I can only imagine how many questions a community pharmacist would end up getting that. And so each of the directions for the missed dose is different. And so just kind of pulling out, the package insert if it's not within the box, and that you can open or whatever in the community pharmacy, or using your resources. But that is one thing that really can help a patient, because typically if it's within 3 days of when you should have delivered it, you can go ahead and give it. But if it's more than 3 days for the majority of the products, then you have to wait until that next time, or you go ahead and would need to decide how you're going to handle that.
And I think the role of that community pharmacist is crucial, because even when we're not in clinic, if the patient had a question, they're probably gonna have to call their CVS or Walgreens, because I'm not at the VA, every day, all hours of the day. And I go back to that point where maybe it's good for them to hear it again, because if you think about who patients trust, it's nurses and pharmacists. We're like number 1 and number 2. And so a lot of my conversations are like, well, I went to my primary care, I went to my so-and-so doctor, and they gave me this, but I didn't actually start it. I wanted to talk to you before I did it.
Sure.
Or,
oftentimes too, they may be a new patient to your clinic, but they've been going to that pharmacy for 40 years.
Mm-hmm.
Correct.
Yeah.
Right, so there's still that trust reinforcement of, yes, Dr. Patel knows what he's talking about, and
right.
here's how we're going to work together, but that's where that trusted relationship exists.
Yeah, and they're here at
So
the second
leverage it.
time, and it's the same set of side effects I was told, and it wasn't anything different, or they didn't minimize something, or say, exaggerate one, and so I think that helps, but I think them kind of reinforcing it definitely makes a difference.
For each of you then, if you could write one thing on the prescription besides the prescription that said, please do this or that, what would it be?
So including.
I'm handing that prescription to
to-
the community pharmacist,
Right, and you have on there the device and the needles.
device and the needles.
What else? I would actually please review storage.
Please review storage is yours.
I would want a demonstration.
Please demonstrate. And if you don't know, go to this website.
Right.
Yeah, I would say just go through the side effects and what they can expect.
Okay, I would put, and make sure and follow up with our excellent panelists within a week.
Yeah.